Hello student, today we will discuss new topic that is BPH means benign prostate hyperplasia. So before I could move on the topic, so those are not subscribed my channel, subscribe the channel to motivate me to upload more and more videos which is much more helpful for all nursing students and to serve as a immediate referral for your success as well as a mine. Thank you student. Okay, we'll move on a disease benign prostate hyperplasia. Regarding prostate gland, let us see the anatomy and physiology. So, what is prostate gland? Prostate gland is a exocrine gland. It is a size of walnut, 30 gram. It is a one of the genito-urinary reproductive organs of the male, commonly affected by benign and malignant neoplasm. Benign enlargement of the prostate gland is extremely common, especially as the age advances. So it is situated base of the bladder, means the below part of the bladder and just behind the urethra. So this prostate helps to control urination by pressing against the part of the urethra it surrounds. So the main functions of the prostate gland is produce some of the substance that are found in normal semen, that is mineral and sugar. Then one more, it mainly produces a protein called PSA. It is very important, put underline for that, that is prostate specific antigen. Especially it helps keep the semen its liquid form. If in case this PSA amount is increased in the blood, it means it indicates the client, the man is suffering with the prostate related disease or disorder or prostate cancer. So for that to know evaluation, various multiple investigations are required. So we will move on disease condition. So you can see in a picture, this is the normal prostate here and this is the enlarged prostate. So when prostate gland enlarged, what happened? It will compress the urinary bladder as well as a urethra. When it compresses these both, what happened? The urine cannot drain from the bladder through urethra to outside. So the urine will be abnormally collected in the bladder itself and it will injure, as well as since it is stored inside only, it may lead to UTI, urinary tract infection. So the urine cannot drain it out, so it leads to various lower urinary tract symptoms. That is many things, urgency, frequency, UTI, hematuria and many other things. So you can go to the definition as I said. Hematuria means blood in the urine. Okay. So what may be the causes or a risk factor for BPH? Presence of 5-alpha reductase and DTH levels. 5-alpha reductase and DTH are the two enzymes. Enzymes means it is a these are the proteins help to speed up the biochemical reactions, and these enzymes is a must because it keeps the genital organs in a healthy condition, especially prostate gland, and throughout the life it helps for the growth of the prostate gland. So these two enzymes itself causes BPH. A defect in local substance that regulate the programmed cellular death means DTH and 5-alpha only. Imbalance of local growth factors, DTH. Local inflammation. If the client is prone for more like a genital infection means there is more chance. Genetic factor, family history. Obesity, excessive bad cholesterol. Diabetes mellitus, cirrhosis of the liver means damage of the liver. Heavy alcohol use means excessive use of either prescribed or a self-medication like alpha-adrenergic agonist, diet pills, counter cold medication. See, these medication may be required during the suffering time and the client has got particular health issues. But that is in a particular duration, how much the doctor has told. But some clients taking apart from that also and whenever they wish without doctor consultation, that it should not. It cause BPH or any other diseases. So what may be the clinical manifestation when this bladder as well as a urethra is compressed due to the enlargement of the prostate gland, what happens? It leads to lower urinary tract symptoms, that is urinary retention, bladder distension. When bladder is distended, urine is not gone out, what happens? There will be a kind of discomfort will be there, abdominal pain will be there. Nocturia, nighttime urgency, frequency, means whole night the client is waking to pass urine only. He is not getting proper sleep. His sleep pattern is altered. Urgency, urge to void the urine. He may be in anywhere, attending the office meeting or in a work site or wherever. He feel to pass urine and immediately he has to go, but unable to void or empty the bladder completely. Dribbling, leakage of the urine. UTI, due to this urinary tract infection, there will be a fever. Hematuria, hematuria means blood in the urine. Due to when urine is full, it will damage the, injure the urinary bladder. So, let me see pathophysiology. So, what pathology means? Disease condition. When diseases occur, physiology, how the normal function is altered. So, presence of 5-alpha reductase and DTH level compromised and contributing to prostate enlargement. So, I said these two enzymes are very important. It keeps the prostate gland in a healthy condition. Then how come these two enzymes leads to BPH? See, these two enzymes, when client was young, that time also it was producing in a same amount. When he is old also, it will produce in a same amount. The production itself will lead to BPH. So, obstruction of urethral. So, due to these two enzyme overflowing, what happened? The prostate enlargement. So, enlargement leads to obstructal urethral outlet and leads to various symptoms. So, you can write all that symptoms. DTH means dihydrotestosterone. So, you can go through this para. It's nicely explained. So, you will understand this. Okay, next we will move on. Diagnosis. How to diagnosis? When client come to the casualty, history collection will be there. He say a lot of history, what symptoms he is facing, since how many days, all that things. After that, the doctor will do the physical examination head to foot. Along with that, using 4 methods: inspection, palpation, percussion and auscultation. Pre-digital rectal examination means through 3 finger, doctor will insert 3 finger inside the rectum and he will rotate, and he could feel through the palpation, he could feel some of the abnormalities. On palpation, bogey consistency and discomfort. Urine analysis, urine for micro, urine for exam, urine for culture and sensitivity. It shows the presence of infection. Okay, multiple investigations are required. Blood test for kidney function, that is urea, creatinine and nitrogen. Blood electrolyte, liver function test, blood coagulation test, that's the bleeding time, clotting time, prothrombin time, as well as a prostate specific antigen. So, usually a prostate related problem, this prostate specific antigen will be elevated more than the normal. IVP means intravenous pyelogram, X-ray of the male genitourinary system after giving contrast. IPSS, International Prostate Symptom Score. It is a standard score sheet. When client says the symptoms, the doctor going on note according to that chart how many symptoms are present in the client. Cystourethropy means visualization of the bladder to see how much it is damaged, any injury or any bleeding. So, how to manage this? Now, okay, in diagnosis, ultrasound also is there. In ultrasound itself, we will come to know whether the client is having mild, moderate enlargement or a severe. Mild to moderate, usually not required any treatment. So, in case of mild to moderate, what doctor will do? Watchful waiting. Then to relax the prostate smooth muscle and some extent to reduce the symptoms as well as the pain, drugs, alpha adrenergic blockers, that is a cap, Silodol and tab, Veltum 0.4 mg will be given 4 to 6 months. It's based upon patient condition and all. So, Along with that, follow-up will be there for to check whether prostate is enlarged or not. Relieving retention by indwelling catheterization. If client is having severe pain due to urine collection, in such condition, doctor will do the catheterization. With the catheter, will send the client to home and follow-up will be there every week. If patient is capable for self-catheterization, means self-catheterization is taught to the client. If bladder is enlarged, inserting the catheter and draining the urine. And along with that, follow-up will be there. When follow-up, ultrasound will be repeated. In case the symptoms are aggressive, not reduced, it is still more increased, as well as the prostate enlargement is increased, means the doctor will plan for the surgery. So there are many surgical surgeries are there. So the first one is a prostatectomy. Prostatectomy means the part of the gland causing obstruction will be removed through the surgery. TURP, transurethral resection of prostate. So this is the gold standard procedure. Most probably 95% of the client undergoing for TURP. In TURP, several types are there. Okay, TURP only. Okay, sorry. The third one is a suprapubic prostatectomy. That name is given according to how they will give the cut. Okay. Suprapubic means it involves a lower abdominal incision and the incision is a straight. Retropubic prostatectomy means the surgeon approaches the prostate through lower abdominal incision without entry into the bladder. So the cut will be given in a left to right. The next one is fifth one is a perineal prostatectomy. Incision made into the perineum between the anus and the scrotum. Sixth one is a transurethral incision of the prostate. Seventh one is a transurethral electrovaporization. Means high beam of laser light. Through the laser light, the extra growth prostate will be dissected or cut, removed. Next one is a prostatic stent. Means a tube is placed in urethra to improve the urine flow and empty the bladder. Some extent it will give relief to client. Hyperthermia and thermal therapy. Here the high heat energy will be passed to the passed to the targeted part or area to destroy the extra growth of the prostate. So TURP. So what is transurethral resection of prostate? So this procedure is done under general anesthesia or spinal anesthesia. No external surgical incision is done. Through urethra to excess obstructive prostate tissue will be removed. A large three-way indwelling catheter is inserted to bladder after procedure to provide hemostasis and to facilitate urinary drainage, in the sense to prevent bleeding as well as to facilitate. When doctor will insert an instrument and he will cut the extra growth of the prostate, so the small cut piece as well as the blood clot, everything will block the urinary bladder. It has to completely come out. To facilitate that, to bring everything, that the three-way catheter is put in one catheter, the fluid will be hanging. The fluid will go normal saline. From the another catheter, after cleaning bladder, all the waste product, blood clot as well as the cut piece, everything will come out. It has to place until the return flow is cleared. So it is a responsibility of the nurse to watch. Bladder irrigated continuously or intermittently to prevent obstruction from mucus and a blood clot. That is only bladder irrigation, whatever I said just now. So you can see in a picture, this is the instrument inserted and excess tissue is removed. So while cutting, the small piece will drop there as well as the blood clot, everything. So all that through the irrigation, they will remove it out because it has to come out. Otherwise, again, it will cause after the surgery complication, blockage. Okay, Complication of the surgery. What complication? There is more chances for the complications. So the doctor as well as a nurse, doctor from their part, they are very careful. As a nurse, it is our responsibility. We should be very careful. So we should know the complication. One is the bleeding. There is more chance during the surgery. If bladder is injured or urethra is injured means infection. Because foreign body, the instrument is inserting. If it is not aseptic technique, the instrument is not properly sterilized, there is more chance. Persisting obstruction due to clot or any mass. Accidental displacement of the catheter, again it leads to further complication. Stenosis of the urethra, narrowing, it will become very small. Again dribbling of the urine will take place. The urine cannot come out properly. Epididymitis, inflammation of the epididymis. Bladder neck contracture means bladder neck, the muscle unable to contract properly. So again the urine retention will take place. Client may face same problem. Retrograde ejaculation, backward flow of the semen or a urine. So in such condition, immediately the client as well as if nurse is observed means should inform to the doctor and should carry out whatever is a order. So as a nurse, it is our responsibility, nursing management. If client is undergoing for the surgery means pre-operative as well as a post-operative management will be there. If it is a pre-operative management, pre-operative assessment include history collection as well as a physical examination, the ability to empty his bladder, family history, any drug history, signs and symptoms, everything has to be assessed as well as a head to foot. So after the history collection, physical examination, the nurse will come to know various symptoms. To relieve that has to form pre-operative nursing diagnosis. So after the pre-operative nursing diagnosis, she has to plan of action, she has to implement and she has to evaluate how much the client is relieved from the symptoms. Okay, after the surgery, once surgery is over, the client is brought to the post-op. The post-op nurse has to receive the patient, put the patient in a proper position, and in front of the OT staff, doctor as well as anesthetic, the surgical site has to be inspected. Surgical site, suture line, whether it is intact or not, any complication is occurred in the OT, or tubing also, how many tubings are present, any drainage is present. If drainage is present means how much amount, whether the color has to be noted, if the tube is blocked or any clot is present or any pus is present, if anything has to be noted and immediately informed to the doctor there itself. Bleeding also, if any fresh bleeding from the site. Okay, all this has to note down and later has to take over the chart from the OT nurse. Okay, then later post-op nursing diagnosis. According to the symptoms, see, immediately after the surgery, the client will be having a pain, altered consciousness, nausea, vomiting, kind of a discomfort. The client is anxious about his condition. So all these has to form the nursing diagnosis, objective, plan of action, implementation as well as a evaluation. Okay, the last part usually is a part of nurse's responsibility. When client is discharging or before discharging, it is a responsibility to educate the patient. That is especially wound care, aseptic technique, after the bath and keep the part clean. In order to prevent injury, avoid strain during defecation at least for 6 weeks. So having more fluid, fiber diet, especially to avoid all kind of a bad habit like smoking, drinking, taking self-medication, and teaching pelvic muscle exercise to strengthen the muscles. That is a sitting and a standing and a movement of the hands as well as the legs and some other exercises, and should tell the client to observe for any above told complication, bleeding, pain, inability to pass urine or a fever. If anything, immediately to seek the doctor in order to prevent further spread of a complication. Follow-up is a must along with whatever doctor is saying the investigation. So hope student you understood BPH. It is very important. When it comes to nursing management, as a student, it is your responsibility. You have to refer the book and note down standard nursing diagnosis. Thank you, student.